Welcome, students. Today we are continuing with our Chapter 6 PowerPoint lecture. Today we're going to be covering slides 24 to 30 in this section. So the topics that we'll be covering today, we're going to be going over a little bit more with vital signs. So we'll talk about mucous membranes and capillary refill time, also known as MM and CRT. We're also going to look at things like monitoring production or output, like urine production and bowel movement or gastrointestinal monitoring. We are also going to address some nutritional support questions, as well as getting into some grooming care. So again, the first topic that we're going to look at is we're addressing some of the vital signs that you'll be performing in the clinic, which is going to be mucous membrane and capillary refill time. Both of these go hand in hand with one another. If you're checking mucous membranes, you're going to be checking CRT at the same time. Now, when I'm talking about mucous membrane, we're specifically talking about the color. So mucous membranes, for this example, we'll look here at the gums. That's going to be the best place to observe them. And be aware, it's what this vital sign really is an analysis um, of the pet's overall pigmentation. So ideally, when looking at the pet's gums, whether this is a dog or a cat or a horse or a farm animal, looking at the gums, they should be a nice, normal pink color. What this pink color is telling you is that it's a result of oxygenated in the hemoglobin of the red blood cells in the capillary bed. So it basically means that oxygen is reaching all those tissues. It's into that blood, attaching to that hemoglobin that's going and pumping around that systemic circulation. It's perfusing the oxygen to the tissues. They are nice and healthy. Now, pink or light pink, both of those are normal mucous membrane colors. Totally nice and normal what we want to see. However, you will also see mucous membranes that are not WNL, so they're not within normal limits. And those are going to be colors like pale or white, brick red, canatonic or blue, and even icteric or jaundice. So again, these are all abnormal mucous membrane colors. So if you were to lift up on their lip and see that, again, the color is not that pink or light pink, it's any of these others, it can indicate a serious medical problem. It can also implicate that there's an emergency that needs to be addressed right away. So let's walk through these different mucous membrane colors. So the first one that we're going to look here on the list is pale or white. And as you can see, it's pretty much as pale and as white as the teeth are. There's really almost no color at all in these pale mucous membranes that you see in this example up here. What that means, pale or white. Well, it can mean a few different things. It could mean that the patient's going through hypothermia, which is a really low body temperature. It could be due to pain, decreased cardiac output. So this also could be due to some kind of cardiac or circulatory issue. It can be caused by anemia or peripheral vasoconstriction. It could also be aware that it could mean that there's some type of blood loss somewhere in the body. One of the clear-cut times that I can remember seeing a patient that had really pale, basically white gums. It was a doctor that I worked with. It was one of her huskies. And her husky was doing great, and all of a sudden it got really, really sick pretty much within a day. And when she brought it into the clinic, the gums were almost white, like what you see here in this picture. What happened her husky actually ended up developing a cancerous mass on their liver, which isn't abnormal. And the mass ended up rupturing. And so there was a large amount of blood loss inside the body cavity pretty quickly. So, as you can imagine, that was the reason why this patient started feeling very unwell very quickly and why the gums went pale white. There was a lot of blood loss. Now, don't worry, we did emergency surgery on this doctor's dog, and the dog recovered and lived a long, healthy life. We removed the part of the liver that had the cancerous mass. If you didn't know, the liver is a regenerative organ that can regrow itself, which is pretty incredible. Anyways, might seem like a really crazy emergency, absolutely can be. Um, but again, my one experience with that was severe internal bleeding and trauma actually caused the gums to go super pale like that. Some kind of internal bleeding. Now, the next one that's on this list is brick red. So that's going to be the one down here at the bottom, and you can see just how much darker and red this looks versus like your normal pink or light pink. It's much darker. This red color that you're looking at on the mucous membranes can signal early shock, which we talk about shock quite a bit in our anatomy and physiology module, module 101, because I go into an entire lecture about the circulatory system and the nervous system and kind of how it reacts. And shock can happen as a result to traumatic injury, traumatic stress, and the circulatory system starts to revert, which means that it's only going to be pumping blood to the vital organs. It's not going to be worrying about the limbs and anything that's accessory. It's just going to worry about keeping this animal alive. Now, there's also a few different things that can happen here as well. Um, Hyperexcitability, CO2 retention, fever, or endotoxemia. Um, Endotoxemia, this is to give you a little bit of an example here. This is a septic condition that's actually caused by bacteria escaping from the bowel into the bloodstream. So do take this with a grain of salt as well. You are recording these vital signs, okay? Your main job as an assistant is to check the vital signs and record them. It is not your job to determine why the vital signs are this way. Is it important to know the main reasons? Absolutely. Yes. However, remember, it is your doctor that's going to diagnose this animal. You're just going to give them the facts. You're going to give them the history. You're going to give them the vital signs that you took. And then based off of that, the doctor's then going to decide what do they believe is wrong with this pet. Now, there's also this canatonic color or this blue that you guys can see here. It's almost like a gray, purpley blue. Really not a great color. This is usually caused by low oxygen levels in the red blood cells. So they're not getting reoxygenated properly. There's a circulatory issue. Um, so essentially, there's problems when the cells aren't being oxygenated properly, they're unable to go perfuse that oxygen to the tissues in that systemic circulation path because there's no oxygen to distribute. So that's a very, very concerning thing to see. Absolute emergency, all hands on deck to try to figure out what's going on. The next one that you see here is called icteric, also known as jaundice. So you see that yellowing color of the gums and surrounding skin areas. The jaundice can even go up onto their nose, to the inside the skin on their ears, around their eyes. When we usually see icteric or jaundice coloring, it's usually indicative of some kind of issue with the liver. The liver is going to be filtering that blood. It also could be due to some kind of failure, organ failure or disorder. Sometimes we see it commonly in like puppies and kittens as they're just adjusting to life and getting their body systems to work normally, especially if they were preemie, in any type of way, neonatal. But again, we've got some absolutely abnormal colors here versus our nice and normal light pink to pink. So important to know the difference between them and what we would be notating them as. So be memorizing things like icteric or jaundice and be memorizing that canatonic color. Very important to know what those are so that you can notate them correctly if you ever see them. Along with checking the color. So mucous membranes, we're going to be checking the color, notating that color. We're also going to be notating, excuse me, we're going to be looking at another vital sign at the same time. Usually we do capillary refill time and mucous membrane at the same time because it's both looking at the gum. So there's actually three different things that I like to do with mucous membrane and capillary refill time. I'll check the gum color, but I'll also check the gum moisture because you're going to be taking usually your finger and pressing it onto the gums. However, if it's not safe to do so, you might not be able to do this. You can use a tongue depressor or a pen or something instead to kind of poke at the gums. Um, but if you're able to, the patient is nice enough and you're able to, I like to take my finger to do this because I want to feel how moist are the gums. That's also something that's really important to notate. Are the gums nice and moist? Or do they seem dry? Or maybe even we call it tacky, which is when it's like kind of sticky on your fingers. If the gums are tacky in any way, that is a absolute sign of dehydration. So that's something to notate as well. That's usually something I would include in the mucous membrane reading. Now, for capillary refill time, again, this is CRT. We are going to be running a test that will determine the rate of return of color to the oral mucous membranes after the application of gentle digital pressure. So essentially, what you're going to be doing is you're going to be taking your finger, or again, if this animal's not super nice, they're showing signs of aggression, you can take a tongue depressor, that's completely fine. And you're going to be taking that, lifting up on the lip, and pressing that into the oral mucous membranes. I do it for like a few seconds. 2 or 3 seconds is fine. And then you're going to lift off on that pressure. And you are going to count how long does it take for the gums to return normal. When you press down on the mucous membranes, it's going to splurse out those capillaries and it's going to cause the membranes to turn white. When you release that pressure, the capillaries are going to race back in. And that's what you're timing is that capillary refill time, right? The blood's going to race back in. Normal capillary refill time, it should only take about 2 seconds for that blood to, and those mucous membranes to turn back to normal color with the blood flowing back in. If it takes anywhere that's longer than 2 seconds, that is also indicative of dehydration. It could also be a sign that they're in shock. And it could also indicate that there's some kind of decreased peripheral perfusion somewhere. So something going on with the circulatory system. Again, most of the time it's referring to dehydration. That being said, I want to give you guys a visual because I know that talking about it and doing it are two totally different things. So I have a really quick video. It's only 40 seconds long that I want to show you about doing a capillary refill time, just so that you guys can get a little bit better of a visual. And then be aware, you're going to be able to practice this all the time in your laboratory setting with the animals that are coming in and stuff. So you will get good practice. You can practice on your pets at home, absolutely. Okay, let me just get my video shut off here so that hopefully it gets a little bit better quality. We'll watch through this short video about how to take the mucous membranes, and then we'll go back to the slides. So again, this is just a visual representation of your capillary refill time. And again, be checking the mucous membrane color as you do this. So as you can see, they're just holding their finger down. They're holding the lip up. They're just gonna press their finger down on that oral mucous membrane for a few seconds and lift up. And when they do, you're gonna notice it gets a little bit lighter. Again, it looks white and then the blood will kind of flow back in. So we'll watch that here. So pressure, 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 lifts up. It was white and now the color is refilling. So you count, again, how many seconds does it take to go from that white? So that would be 1, 2. That's a normal 2 seconds. Very easy to do. But again, if the pet is being aggressive, not being nice, you don't feel comfortable, try to take that tongue depressor to use it if we can. That would be ideal. Okay. Before we get moved into the next few topics, I did want to ask Teresa, Miss Thrasher, do you have any recommendations for doing CRT on aggressive or non-compliant animals? I'm kind of curious.
So a lot of times we'll use like a little pen instead of our finger.
Yeah, a pen or like a tongue depressor or something like that.
Yeah. And a lot of times while they're like hissing and spitting at us, we just, as they have their mouth open, we just press and then we quickly look. You gotta be quick.
Absolutely. Yeah, try to get it done as quickly as possible. Yes, I totally agree with you there.
Or we try to give them something to calm them down and then we can kind of more accurately check. But if they're fighting us, then who knows? Maybe their perfusion is pretty good
Right. Right, exactly. We're not
because
probably
they
not
have the
looking at
energy to
something
fight.
right. We're probably not looking at something super abnormal at that point. You can technically do it with a muzzle on. You would just have to like lift back into like the very cheek kind of corner of their mouth. You could technically still do it. Sometimes doctors, though, because I'm seeing some questions in the chat, sometimes doctors, they'll kind of weigh it out and be like, is it worth it? Is it not? Because obviously it's not worth having any staff members getting injured or bit. So there will be with some patients where you just might not be able to do it. If you're unable to do it by yourself, you might just need a restrainer, you might just need some muzzles or some restraint tools. Um, but at the end of the day, if you're struggling to get it done, always run it by the doctor. Sometimes they're going to tell you, hey, it's not that big of a deal. Other times they'll be like, no, let's maybe, yeah, like Teresa said, add in some sedation or something to calm them down because we really need it. Um, but kind of case by case basis. Can be a little bit harder, of course, because you're looking directly at the oral mucous membranes in the mouth, which is where the teeth are, which we want to avoid if the animal's being aggressive or non-compliant. Okay, so that was our mucous membrane CRT. We do have, let's see here. The next few slides are talking about monitoring urine production and then also monitoring bowel movements or gastrointestinal monitoring. So, when a patient is hospitalized, we should be monitoring their urine output as well as their fecal output, right? When are they pooping and peeing? That's really important. Why? Because if we're feeding them, we need to know, right? It should be making it through the whole system. And also, if they're recovering from surgery, they're sick, maybe they're just starting to eat again, we need to monitor what's going into their bodies as well as what's going out of their bodies. So you will get adequate training on this. Your lab instructors will probably show you as well some templates of kind of like what hospitalized notes look like and how you would be performing those. Not all hospitals do inpatient care. Um, they would technically be a clinic. So if you work for a veterinary clinic, they might not have hospitalized patients overnight. They might not even do critical care or anything like that during the day. So whether or not you will be doing progress notes and doing, care on hospitalized patients will really depend on your workplace. If you are working in an environment that has boarding, which are animals that are staying in the clinic while their owners are on vacation, or if you're working at a hospital that's 24 hours or that does provide hospital monitoring care and overnight care, then you will absolutely be notating things like urine and fecal production. So, with dogs, we like to take them out on walks if we can, if they're mobile. If they're immobile, we can't move them, then we're going to have them on potty pads and we'll be turning them every 2 hours. And there's a little bit more of a stricter protocol with patients that are immobile. Even with them being immobile, we can put them in I'm forgetting the name for them right now, but it's basically like little slings that we can put their legs into and kind of carry them, whether that's their front or hind end to help them walk. Because ideally we'd like to walk them to allow them to urinate and defecate on the grass or in a grassy kind of area. Again, we can use potty pads and stuff in the kennels if we need to. With cats, y'all know we use litter boxes and we'll be cleaning those litter boxes twice daily so that we can notate the urine and fecal output in their chart. We should be notating this at least twice a day, if not more often if the patient has accidents. Um, Now, some of these patients for urine production, they'll be on urinary catheters. This is really common with our male cats that can get blocked. A urinary blockage is when there is urinary crystals and sediment that build up and get stuck in that male urethra. It tends to get stuck in our males because it's a longer, more narrow, kind of S-curved shape of a urethra versus the females. It's super short. It's only about an inch, inch and a half long, and it's not nearly as narrow as the males. So when they get blocked, we have to place a urinary catheter to flush out the sediment to remove the blockage, and then we keep it in for a few days to make sure that they're not going to get blocked again before we send them home. And if they're ever connected to a urinary cath, whether it's a blocked cat or maybe it's another situation, hit by car, bladder rupture, there's many different reasons for this. You would then just be monitoring how much urine is in the bag. And we technically use recycled fluid bags for this. It doesn't have to be sterile because it's urine coming out of the body. We still use sterile infusion sets and everything like that. But when it comes to the bag, we can use just like a recycled fluid bag, one that has been all used up to collect the fluids. And then you can measure it with the bag or you can measure it with syringes, needles and syringes as you inject it out and notating it on the charting. Again, your hospital will go over their own protocols with you and do notate that we're going to teach you this in lab and we'll teach you different methods. But remember, a million methods to the madness. There can be one hospital that wants you to do it one way and another that wants you to do it a different way. And you kind of just have to go along with what your hospital protocols and settings are, or even sometimes it's doctor preferences and how they want it to be presented and whatnot. So just things to be aware of. Now, same thing for that gastrointestinal monitoring or monitoring the fecal output. So we need to monitor all excretions. And again, this is looking at a little bit more of a blanketed term here with gastrointestinal monitoring. So they're not just looking at feces, they're also talking about things like vomit or even saliva. There are animals that have phytalism, which is hypersalvations. They just salivate a lot, and that can also be associated with certain medical conditions. So those are things to notate. Of course, if a patient vomits as well. And then standard is the urine and feces. Now, you do want to try to differentiate regurgitation from vomiting. So be specific with what you see. I know that sounds kind of gross, but well, we're working in medicine. Sometimes the things that we work with are a little gross. So when it comes to things like vomiting, you need to notate, was it clear? Was there food in it? Was there grass? Was it discolored? Is it pink? Is it red? What does it look like? Because that will absolutely and can change the treatment plan for this pet and help the doctor determine what's going on so that they can get a proper diagnosis. So, really, really important that you notate what you see in that vomit and also notate how frequently that it's happening. If the patient has any type of waste and soils themselves, so they get any type of vomit, feces, urine, whatever it is, they get it all over themselves, it is our job to keep our patients clean and free of any body waste. So we need to be monitoring them often, keeping eyes on them at least every hour, if not more than that. We're working around them all the time. Um, And this is for hospital or for boarding patients. No pet should ever be left in their own, to be soiled in a kennel for very long at all. The second that we notice it, we need to be getting them out and cleaning them immediately, especially with urine. Urine can cause ammonia burns all down the legs and on the body. And let's be honest, if you're not feeling well, you certainly don't want to be sitting in your own gastrointestinal outputs, excretions. That's no way that we should be treating any animal. And again, a big part of our job is to take really good care of them. So cleaning them up right away is essential. And even if it's not your pet that you're monitoring that day, if you walk by and you see something needs to be done, we don't just shrug it off and say, well, not my patient for the day. That's not how we roll here. In veterinary medicine, we all work together. It's a huge team effort. And remember, we're doing this for the animals. If you ignore the pet, who's going to suffer? The animal. And that's not what we're here for. So even if it's not your patient for the day, it's important to hop in and help. Even if you just let that person know, hey, your patient soiled themselves. Do you need some help? Or would you like me to take care of it? Um, that open communication is really important. And again, it's also seen as malpractice. It's a form of abuse to not clean patients when they're soiled. We cannot be leaving them for hours on hours because it's not your job or you didn't have free time. You got to make that time. It's absolutely considered malpractice and can be grounds for a lawsuit, especially if that patient gets burns, and has reactions from that, from not being treated properly. So very, very important. Another term to be aware of is EMSIS. This term means to have vomiting. So if we are inducing EMSIS, we might be inducing vomiting. Maybe a patient ate something that they shouldn't have. You'll see that all the time during like big major holidays like Christmas and Valentine's Day and Thanksgiving when all the treats and foods come out and animals get into all the things. So sometimes we're actually inducing EMSIS, right? Inducing that vomiting. Other times we're trying to stop that vomiting and we're going to give an antiemetic medication that's going to prevent or stop those feelings of vomiting. Before we get into our next slide here, a little bit more about nutritional support, and we'll talk about some grooming topics as well. We are going to go on a break here. So let me just get this recording paused. All right, welcome back from your break, students. So we're going to be getting into our next slide here is talking a little bit about nutritional support. So when it comes to taking the history, we ask questions to the clients about things like, what are you feeding your pet? How much are you feeding your pet? Does your pet have good appetite? Um, and we ask those questions because the doctor is going to look at a whole slew of different things. When they come in and do the health exam, they're going to be looking at all different parts of their body and different factors. And nutrition plays a huge role in development. It plays a huge role in daily lifestyle. And especially things like the quality of food can also determine risk for diseases and illnesses later in their life. Now, that being said, having great nutrition is not going to make it to where your pet will never get sick or will never have problems. However, it can drastically drastically decrease the chances for that, and help them live a longer, healthier life. Now, that being said, I'm not here to give you a whole nutrition spiel. We do have a module where we talk a little bit more about that. But something that I do want to bring up is we have prescription diets in the veterinary field. And this is what you'll deal a lot with when patients are in the hospital and you're doing things like care and nursing, what this entire module is about. You will more than likely be feeding these animals prescription diets. We have many different prescription diets. They're made by, there's three main manufacturers. There's Hills, Science Diet, there is Purina, and there is Royal Canin. Purina is like the newest one to the game. And it's hard because Purina has some really low grade food that I would never feed my animal. But then it also just came out with a prescription diet that I think is phenomenal. So they're kind of a brand that the newest to the game. They have a huge wide variety of foods and things like that. If I were to tell you what my preferable favorite is, I would say it's Royal Canin. I just really like Royal Canin. I see that a lot of animals really like it. It's just favorable when it comes to in comparison to Hills. A lot more pets like the taste of the food and they're more apt to eat it. And when you're spending good money on prescription food, you want to make sure that you're spending it on food that they're going to eat and help them feel better. So, a lot of different foods, like for example, if the patient's hospitalized, you'll probably be feeding them a critical care nutritional support food. These prescription diets, they come in dry food and in canned food. We also might be giving them a diet that's specific for their health conditions. So we have diets for example, there's diets for diabetic patients, there's diets for cardiac patients, there's diets for patients that have a lot of stress, there's diets for patients that have a lot of allergies, hydrolyzed protein diets. We also have diets for animals that have gastrointestinal stress. So for like low protein versus low fat diets and all sorts of stuff. So depending on what's happening with the patient, we more than likely have a really great prescription food that could help fit what is needed during their hospital stay. And sometimes pets will stay on these prescription diets for longer than their hospital stay, maybe for a few months. Others, it's going to be a normal dietary switch where they're going to have this prescription food for the rest of their life. We see that with a lot of like lifelong health conditions. For example, I talked about it a little bit earlier, but when cats get blocked, specifically male cats, they're really prone to getting blocked and having urinary stones and crystals and issues, especially if they're neutered. We have prescription diets for urinary. In Royal Canin, it's called SO. In Hills, it's called CD, and Purina, it's called UR. Those are the different blends that they have for urinary support, and it helps balance out the pH and acidity levels so that crystals will not form anymore. And so that's a lifelong nutritional support that you can give them to prevent them from ever having that blocking medical condition happen again. The thing about cats getting blocked is once they get blocked once, they will absolutely do it again. And it's not a matter of if, it's a matter of when. So most of those cats that have urinary issues, which it's pretty common, will go on a lifelong prescription nutritional support. And most of them do absolutely fantastic, never get blocked again. And it's so much easier than having to give your animal a daily pill or medication, especially cats. So again, some of these diets are short term, help you get better while you're in the hospital. Other ones are for lifelong to help support different medical ailments and issues. So I want to show you a quick video of oh, one moment here. Let me get this reshared because it doesn't want to share my other screen. So just one moment. Okay, now the video screen is shared. So I'm going to come over here and I want to share a video about prescription versus over-the-counter pet food, kind of why we have prescription diet, what's recommended, and kind of just feedback from a veterinarian themselves about again, mostly focusing on prescription pet food because that's what you're going to be dealing with in the hospitals, especially when you have sick pets and you're doing that nursing care. So we'll get into this video, and then once we're done, we'll go back into our PowerPoint with one more slide and one more video.
Hello, welcome to VMC. I'm Dr. M. Today we are going to cover prescription diets and how they are different in generalities from the over-the-counter options you can find in the pet store, and we'll also touch on some basic common scenarios where your veterinarian might recommend them and why they are doing so. Join me, you'll learn something. One of the major differences between prescription diets and OTC formulas is the amount of research that the WSAVA compliant companies put into that formula. Of course, all WSAVA companies have a good amount of research into things like the bioavailability of the micronutrients in their diets and making sure that the diet has enough of those vitamins, minerals, carbs, fats, and proteins that the species that it's being fed to needs in order to remain as healthy as possible for as long as possible. But when we move to a prescription diet, we go from that sort of general nutrition to more specific nutrition. The prescription diets have more stringent ingredient testing and final product testing and guarantees about the product and what its effect for the pet will be. Over-the-counter formulas don't have any of those things, and that makes sense because those are expensive things to prove, and to maintain those excellent standards in production does take a lot more effort and time, and it does cost more. And so the biggest reason these diets are prescription is so that you don't feed the wrong thing to the wrong animal and inadvertently cause some trouble. This is because a lot of these prescription diets are not formulated for things like growth. There are also a number of scenarios where if you fed a specific diet to an otherwise healthy animal, that the micronutrient levels would actually be wrong for them, and that also would not be optimal for their health. So prescription diets are kept in vet clinics so that we can make sure that they are safe and recommended for the animal that they are being fed to. Let's cover some specific situations where you might be asked to feed a prescription diet. One of the very common ones is when there is GI upset. It used to be recommended to just feed a bland diet of chicken and rice for a couple of days and then blend back over to their regular diet. But we know this is not an ideal recommendation because chicken and rice is actually deficient in a number of things that dogs and cats need in their nutrition. And for that reason, it's not an appropriate recommendation to make. Also, chicken and rice is lacking with a lot of the prebiotics and probiotics that an upset GI tract needs to help it get back on track. So it is a far better recommendation to feed a prescription gastrointestinal diet. These are very well formulated to be very palatable, meaning even if the pet is feeling a little off, they'll be tempted to eat. That's the idea. They're also easier to digest, and so the pet's GI tract doesn't have to work as hard to get the nutrients out of them. They also have more of those prebiotics and more of those probiotics in them. And because these formulations are complete and balanced, they are appropriate to feed and then gradually blend them back over to their regular diet when their medical issue is resolved. Another incredibly common reason that you might be told to feed a prescription diet are for patients that have kidney and bladder problems. We do have a lot of research showing that patients with kidney disease who are fed the prescription diets live for a longer period of time than patients that don't. And nutrition is very important here because these formulations are designed to help manage the electrolytes that go out of whack for patients with kidney disease. They also are designed that the protein is a lower amount but incredibly digestible to help the patient maintain muscle mass, because muscle wasting is a very common issue when a pet is dealing with kidney disease. And when we also have patients that tend to have bladder issues, especially our cats fall into this category, feeding a diet that supports bladder health, that decreases inflammation in the bladder wall, that keeps the urine pH at a very precise amount. It minimizes the chance of crystals and stones forming or reforming. It can even help to dissolve some types of stones and crystals. One last common reason I'll touch on is if we have a pet that's having skin issues and your veterinarian is hoping to rule in or out a food allergy component to those skin issues. The reason that we must use a prescription hypoallergenic diet here is because we know that all of the over-the-counter formulas that are advertised as limited ingredient or for sensitive stomachs are contaminated with small amounts of things that are not on the label when they are made and processed. And this goes for all of them. There are no OTC formulas that are appropriate for a proper food trial. I also will occasionally hear rumblings that the reason veterinarians recommend these formulas is because we're paid to do so. This is just completely false. I have not once ever been paid by any of the WSAVA compliant companies to recommend their diets, not once. At this point, these are the best ones, and for that reason, it is in the best interest of your pet to feed these, and that is why veterinarians recommend them. And the vast majority of veterinarians feed those same diets to their own pets because they have read the research studies that have come out. They also see hundreds and hundreds and hundreds of pets, and they see the ones that do best, and what they see corresponds with what the research tells them. We see all the time pets that come in on other nutrition that is not WSAVA compliant, and these pets have GI upset, these pets get bladder stones, these pets have heart issues, these pets don't grow properly. This is such a common problem, and we're just trying to prevent your pet from experiencing those issues. We want what's best for your animals, and if you do see a veterinarian that you aren't convinced that is the case for, then get a second opinion. Not every veterinarian is right for every person. The vast majority of us truly do want what is best for your pet and advocate to help you make the best decisions to keep your pet as healthy as possible. I should also mention that with the prescription diets, the companies do guarantee their palatability. So if you do purchase it, and you take it home and you're sending over gradually, and your pet just refuses to eat it, you can bring back what is left of the bag or cans and tell your vet clinic, my pet would not eat it, and they can help you choose a different option. And the company should reimburse, the food company should reimburse your money back. Check with your veterinarian to make sure that this happens in your country, but where I practice, that's how it goes. Another thing that you need to talk to your veterinarian about, if they're recommending a prescription diet, you need to ask them about which treats, or if treats at all, are able to be given to your pet while they're on that prescription diet. Some of these diets are so hyper-specific that giving any treats whatsoever would unbalance that nutrition and cause issues for your pet's medical disease. However, there are others where giving treats in moderation is fine. The general rule of thumb is that you can feed 10% of their daily caloric intake in treats, and toppers and everything else has to be less than 10% of their daily caloric intake. The other 90% of their daily caloric intake must be from a WSAVA compliant food. You will need to do the math for your specific pet. If you are feeding more than 10% of their diet from treats, you are unbalancing their diet. However, if we're talking about something like a prescription hypoallergenic food trial, in those cases you cannot give any treats at all, period, because those treats will be contaminated and will have ingredients that are not in the prescription food. And so if you are in one of those situations, what often works is to buy the canned version of that diet and make kind of little cookies out of that canned food and bake them in the oven for a little while to make treats. Lots of people do that. Their dogs seem to like it quite a bit. And there are also some treats that are designed to complement the prescription diet. So if they're on this specific diet, then they can have this specific treat. So you can ask your veterinarian if there are any of those types of options for you and your particular pet. If you do have a pet that has an illness where nutrition matters, in those scenarios, a prescription diet is a very important part of the treatment plan. And we are very incredibly lucky to have such excellent research-based diets that are available to support our pets when they are going through medical issues, as these diets do make a big difference. If you have learned something today, please like the video and comment down below about what subject you want me to cover next. I was thinking.
All right, so really good summary there on pet nutrition and kind of what you would need to know prescription versus regular. Really, really great info. Wanted to share that with y'all. And again, we go a little bit more into depth in some different modules about nutrition, but just to give you guys a little bit of a head start about the difference between those prescription versus over the counter. All right, so we're at slide 30. This is going to be our last slide for today. So we'll talk a little bit about grooming and skincare, and then I have one last video to show everybody before we are finished with our PowerPoint materials for today. So when it comes down to grooming and skincare, you will be doing various different procedures in regards to this. Now, be aware, working in a veterinary setting, you are going to do things like medical grooming. I'm not talking about being a full-on groomer and doing hairstyles and cuts and stuff like that. That is actually a completely different certification and completely different schooling you have to go to do grooming. Not everybody can just go and do it, especially if you're working through a business. So when it comes to medical grooming, you might do medical baths. So like a flea bath, or if there's, really irritated skin, we'll do like an oatmeal soothing bath. Again, it's going to be related to a medical problem. Same things with grooming or essentially shaving them. We're only going to be shaving areas where there's an injury, where there's a skin rash, where the doctor is going to perform surgery, um, where we're going to place a intravenous catheter. So we're not grooming, again, doing hairstyles and haircuts. The type of grooming that we're doing is for medical purpose, which is why we call it medical grooming. Now, we also do perform certain skincare. So, using medicated shampoos with the patient that's got some skin issues or alopecia, and then following through with a topical treatment, an ointment or a salve or a paste that goes on the skin. We also perform nail trims. That's a very normal part of our routine and part of our job of being an assistant is doing toenail trims. We also can do anal gland expression or anal gland care. We call that AGE, anal gland expression. Not all animals need their anal glands expressed. It really just depends on the animal. I have seen a trend where more smaller dogs I tend to see need to have them expressed versus larger dogs. It's pretty rare to have a cat that has anal gland issues. If you take your dog to a groomer, they actually will express them during the grooming appointment, but they don't do it the same way that we would do it medically in a clinic. And I'll let your lab instructors describe that a little bit more, the way that we would perform it. And you'll get the opportunity to, especially if you have your own animal, if you're bringing them in to be able to practice. It's a main part of our day-to-day job. Nail trimming, anal gland expression, those two go hand in hand, and you'll be doing them multiple times every single day. Again, the anal glands only need to be done if they need to be done. Most animals will express these normally. These anal glands, they sit right at about like 4 o'clock and 8 o'clock on, if you were to look at a clock, it's like right around there, 4 o'clock and 8 o'clock. There's one of these glands on each side, and they naturally express when the patient has a bowel movement. However, some pets, they don't express as easily and they can get filled up and they can even get impacted. When they get impacted, they can rupture and cause a really big infection to where we have to surgically correct it. It can be a medical emergency. So signs that patients need to have the anal glands expressed is they could be scooting or scratching around, excessively licking their rectum area. Again, trying to manually express them. So patients that need to have them expressed, it's a quick tech appointment in and out. As long as they have a current exam, it's just like a nail trim in and out. And some dogs will need them expressed every month. Others can go a few months between expressions. It really just depends. And some dogs will never need them ever, never need them done. Now, the last thing that we do on here in regards to grooming and skincare is ear care. So doing ear flushing. We, of course, if there's an infection or something wrong with the ear, we will take a gentle cleanser or a flush to flush the ear and medicate the ear. So again, all the things that we see related to grooming or skincare have medical purpose. If you are interested in doing more of the cosmetic grooming, that's a completely separate grooming certificate, a completely different schooling program. Similar to this, where it only takes a few months to get it and then a few months of externship and such. But that is a completely different certification to do grooming outside of our medical grooming realm. Okay, I have one last video to show y'all for today's PowerPoint. Just a little bit about grooming in the veterinary field, some feedback from some people working in the field of kind of the grooming that they do and what they see. So again, don't just take my word for it. I want you to hear from other professionals as well. So I'll get this video played here. And once we're done with this video, we will be all finished for today's section of our Chapter 6 PowerPoint.
Here a few weeks now, and what would you say is the difference? You know, is there a benefit or difference working with a veterinary hospital right in with the grooming salon versus?
There's definitely a big difference. It's there's a safety difference in the fact that I can groom senior dogs more, or dogs that have medical issues, and know that if something were, if they were to suddenly have a medical issue that was unseen, there's a doctor right around the corner that can attend to them. Because I've had some dogs. I had a dog that was very near and dear to me that has since passed away, unfortunately. That had cancer, and he had a large tumor on one of his front legs. And I wanted to be able to continue grooming him, and because of the policies in place, at big corporate places, I had to say, sorry, I can't groom him anymore, and his last days will have to be with somebody he doesn't know.
Yeah.
And he was very friendly. I'm sure he would have done fine with another groomer, but it's still it's a heartbreaking moment.
Right.
And I know that now I can groom all of the pets that I currently groom all the way throughout their life, and know that they'll be safe, they'll be taken care of. Another wonderful thing is that we can give them treats. They can go out and use the bathroom. These are all things we were not allowed to do, because in a corporate place, you have to be careful, about that kind of stuff. Here, they have that opportunity, and I think that makes it more comfortable. It makes it a lot more comfortable for the dogs. Yeah. Because I wouldn't want to have to hold it for hours and hours.
So the corporate people probably they don't want a dog to get loose in the parking lot, and then it's obviously a safety issue. But
they have good reasons. But they have good reasons. But here you have the day camp area and stuff like that, where they can go outside, use the bathroom. You don't have to worry about them escaping. Yeah. So that makes a big difference in their comfort level.
Okay, that was it for a little grooming video. Again, everything that I wanted to present for today. So we're at slide 30. So we are all done with today's section of chapter 6. So with that being said, I'm just going to stop the recording now.